Vishwa. So in Vishwa, we have Vishwa Talks. It is a program to create awareness on various topics and to inspire people to participate in social change. Here, we invite experts to discuss and explore diverse opinions, different perspectives, issues, problems, and their solutions. Along with Vishwa Talks, Vishwa provides free computer literacy program to the underprivileged kids, and we are aiming to train 600 students by this July end. Vishwa also conducts Annadanam campaigns each Friday, and so far we have offered food to over 6,000 people near hospitals in Hyderabad. Through Vishwa events, we have educated 1,500 students till date on significance of our rich culture and heritage to the future generations. So today we are honored to introduce Dr. Sweta Tiwari, a highly qualified and dedicated professional who has a strong commitment to holistic healing. Dr. Tiwari holds a BDS and an MDHM and also a diploma in medical coding and clinical research. With 7 years of dedicated experience, Dr. Tiwari is currently a consultant in Siddha Medicine at Chakrasid. Under esteemed mentorship of Dr. Bhuvanagiri Satya Sindhuja, who is founder of Chakrasid Holistic Healing Center in Hyderabad, Dr. Sweta Tiwari has gained deep insights into traditional practice of Siddha medicine. Dr. Tiwari is actively involved in patient treatment and conducting case studies, working tirelessly to raise awareness about the rich traditional medicine system of Siddha. This centuries old practice has been a long serving alternative therapy, particularly effective in treating various health ailments. So please join me in welcoming Dr. Siddha. So before we get started, I would like to inform the audience that our speaker will be taking the questions from you after the main one. So please leave your questions in the chat box or use raise hand tool in Zoom. So without further ado, let us give a warm welcome to Dr. Sweta Tiwari as she shares her invaluable insights with us on Siddha medicine. Over to you, ma'am.
Thank you, Radhika, for a warm welcome and congratulations for such wonderful work you people are doing through Vishwa. And let me take you as a Siddha consultant to all the viewers who are seeing this thing. I'm Dr. Shweta Tiwari and I'm working as a consultant in Chakrasid, which is located in Hyderabad. So basically, Chakrasid deals with all the kind of ailments which is related to musculoskeletal diseases. Basically, we are looking for those, like every day we are having immense number of patients on daily basis who have got these musculoskeletal diseases. Everybody is aware as to what are these ailments, like lower back issues, cervical issues, maybe pain in your hand, numbness in your hands. So all these ailments we are looking after, and especially the aged people who have got osteoarthritis. So all those things we are dealing at Chakrasit. So let's start with the first slide. So the basic topic which I'm going to cover today is musculoskeletal pain management, because the first shown symptom of any kind of musculoskeletal disease is the pain. So how to manage the pain through the holistic Siddha therapy. Next. Yeah. So first consider what is the musculoskeletal pain. As everybody is aware, any kind of joint pain, first you go to a doctor and then they diagnose as to what actually the pain, what is the major cause for these pain. So it is one of the most common causes throughout the world. Like statistics shows that out of 10 people, maybe 2 3 are having pain in any kind of joint. Okay, people who are aged more above 60, definitely they are going to have some kind of arthritis. Otherwise, if you're not having a good lifestyle, but a little bit out of say 60% people above aged 60 to 65 are going to have some kind of osteoarthritis or any kind of arthritis in your body. So it doesn't even you can see it with the pain, the first symptom of it. Along with it, you can see some kind of redness or some kind of an inflammation. People do have tingling sensation. And many of you might be having some numbness in your hands or in your feet, especially the diabetic patients. Uh, they have numbness in their feet as well as in their hands. Uh, you must have noticed, many of you might have seen that whenever we are sleeping with the wrong direction of your hand, I mean, if you're sleeping on the sideways, and if you keep your hand below your face, after some time you start feeling that numbness feeling. Okay, so you change your posture. So this is a sign, that something is wrong with your shoulder region, or maybe your neck region. The nerve which is passing through that area might be, uh, you are pressing that nerve. That is why you are getting such kind of feelings. So it's not only, externally you can see it. It's an impairment leading to your tendons, your muscles, nerves, cartilages, and joint stiffness. You can feel that stiffness in your knees also, in your ankles also. So this is a symptom of musculoskeletal disease. Next. Now, what are the different types of musculoskeletal pain? Very common is acute and chronic. Like acute can be just sudden pain. Suppose you're walking and you have a fall on the knee. You'll have that kind of pain, sudden pain will be there. It will be a severe one, but it is a sudden pain. Um, Once you must have noticed that whenever we are having a hand and we just bang it on something, you have that pain. So that is an acute pain. Okay, so you can take some medications, and within 1 or 2 days or maybe a week, it just goes back. But the musculoskeletal pain, which is actually the pain, is the chronic one, which is a long lasting. Long lasting in sense, it is more than, you can consider, 3 to 4 months to 6 months and beyond that. You take a medication, you go to a doctor, they will prescribe you some kind of medications, or might tell you to go for some kind of exercises, and all, you do it and it is over. But again, after a few days, it will come back. So that is the pain which is a chronic one, and it has gone inside your body. So that is creating a lot of problem. Now, according to the areas which this musculoskeletal pain occurs, is the bone pain first, like any kind of injury or any fracture. As you can already see in the picture, there is a fracture in the bone. So you can, this is kind of a bone pain. Joint pain is, most people above 50 years or 60 years are having the knee issues. Nowadays, this has reduced to even 45 years of age. You can feel that stiffness while walking. Patients with rheumatoid arthritis have stiffness in all the joints, like in the hands, in the wrist, in the cervical area, knees, ankle. So they have all got of the stiffness. Sometimes you can also feel that there is some redness in the area, some swelling you can see. That is the inflammation. So that leads to your joint pain. Muscle pain, very common. Sometimes you get up in the night, sometimes with the cramps you feel in your muscles in the calf region, as you can already see in this thing. So they are very common. This is maybe because less of oxygen supply to those areas is there, and the reason might be something else, like your nerve is being pressed at some places. So musculoskeletal pain is, not only in one place. It can take over to a lot number of places. Like already mentioned, it may be localized at some area, but after localization, if you don't treat it on correct timing, it might take up the entire area of your legs or hands, whatever area you are having the pain. The last is the tendon and ligament pain. Sometimes you just have a sprain in your hand, or athletes, continuous, if they have a fall, might be some ACL tear can also occur in their knee joints, but this is their bread and butter. So they overuse those areas much more as the capacity of the body. So once they are overusing it without the complete treatment, it leads to a ligament and the tendon pair. Next, please. So this is work-related MSDs, which is very common nowadays. Everybody is having, because the time we are spending in front of the laptops, in front of our screens, and in front of our mobiles, is immensely increased. So, and that is because of the wrong postures that we are having. So work related MSDs, you can see, as all people are sitting at least 8 to 10 hours in front of their laptops, they are unable to sit straight for a longer duration. Automatically our body forms a curvature, and due to this we can have that neck pain. In fact, we can have the lower back pain. Some people might have sciatica, which goes because of the lower back pain. It might harm the sciatica, which travels throughout your leg. So most of us, many of you or maybe your relatives might be having sciatica pain. That is the cause because we are having a wrong posture, longer sitting hours. The other one is because of the use of mobiles, or maybe the use of mouse that we are carrying. We keep our hands at a little distance away from our body, so that creates a problem in our shoulder region as well as our wrist. So we start having that kind of pain in full hand. Sometimes we also feel numbness in our hands. That is because our neck is hurt, and that continuously travels to our hands. Other work related, I will show you. The people who are carrying lot of stuff, like labor class, they have to hold a lot of, because this is their bread and butter. They hold a lot of stuff on their backs, so that also causes lower back issue. Can I have the next slide, please? Okay. uh, this is one which I was telling about, which is due to the posture, wrong posture that we are carrying every day. The first, you can see the wrong sitting. It's not only harming your neck region, it is harming your lower back also. And can you see the area? The upper back area is also curved form. Okay, so this doesn't happen in 1 or 2 days. It takes a little longer time for all the areas to get affected. Initially, some people might have the neck issue, some people might have the lower back issues, but it is going to harm you in a due course of time when you are sitting in a wrong posture. Like, you should sit in a straight posture. Second, can you see it's a wrong standing? People generally stand like this, like with a curvature on their back. The lower one, you can see this is the kyphosis. The area which is like a bend is called as the kyphosis. So slowly and gradually this increases day by day, especially in the females, because during the time of pregnancy, they generally stand like this, protruding their stomach area outside, and their upper back towards the backside. Can you see the posture? So this actually slowly and gradually increases day by day, and then you can have kyphosis or maybe hyperlordosis condition in due course of time. The last is the wrong walking style. Everybody has a wrong walking style. Either they will keep their legs little apart from the center, or if they keep straight, they will keep their neck in front, or they will keep their neck too back. So a wrong posture is caused. While Chakrasid, at Chakrasid, not only we treat the people, we also tell them to correct their postures. It is a part of a treatment, that whenever a patient comes, we also judge them. We also tell them that what is the sitting posture, how should you hold your mobile, what is the correct standing position, how you should walk properly. We train them daily. After the treatment, we also tell them that walk in front of us. We take a video and show them that this is the wrong walking you are doing. So wrong posture can lead to a problem in the lower back as well as the knee issue, and sometimes it might lead to more critical conditions like of your pelvic region. So it might increase inflammation or infection in that region. So it is kind of a holistic treatment that we prefer to do in Chakrasan. Next slide. Okay, these are the most common signs of musculoskeletal diseases, as we already discussed earlier. Also, the first sign is the pain. When you have intense pain, sudden pain, definitely, and it is if it is a long term, like it's not instant, but it is a long term. Definitely, the pain will. Some people might have pain at some kind of activity. Some might have pain throughout the days. Some might have the pain early in the morning. So any kind of pain is a symptom of musculoskeletal disease. Some people might have burning sensation, like you feel little hotness, some sensation will be there. Others might have numbness. Some people might feel fatigue. Any work you do for 5-10 minutes, you start feeling tired and you want to take a rest. In fact, some people, while taking the symptoms, say that we don't want to get up and do some kind of work, because if we start doing some kind of work, we know that the pain is going to increase. The very common example is like migraine people. Okay, many people have migraines nowadays. The reason is because 40 to 50% people might have the reason of neck, wrong posture of neck. If the neck is, you are keeping your postures of neck wrong, there is a chance that the symptom of your migraine might increase. So they generally avoid to get up in the morning, that we don't want to see the sunlight, we don't want to go out of our room, and this fatigueness increases. Okay, so they feel tired, they just don't want to do any kind of work, thinking that it might increase your pain. And the last, one of the most important, is sleep disturbance. Any kind of postures while sleeping. And if you have pain, of course, sleep, you won't get that kind of deep sleep which you want for at least 6-7 hours. Your body also requires that. You're continuously working throughout your day. Your body needs that kind of rest. But because of some kind of pain, or a posture that you're keeping while sleeping, maybe sometimes people have right region pain or the left region pain, they don't want to sleep on that area, on that side. So your sleep is little bit disturbed because of all this musculoskeletal diseases. Next. So now let's talk about what burden does it carry. Okay, it's not only the person himself is getting affected, it's actually affecting your whole family also. And on a wider prospect, it's actually covering lot of your own country's expense also. In sense, they are very costly affairs. Like if you go for a surgery, you feel that, yeah, after if you go for a heart surgery or any kind of other surgeries, you feel that yes, you will be out of it. At least you are giving that kind of money to one surgery, and you will be out of that condition. But no, musculoskeletal diseases, surgery is the last option people go for. To be very clear, they go continuously visit their doctors to take medication. You actually take a lot of medications which are harming your body. So they are very costly. It's not a one day affair that you take 3-4 medications for 4-5 days and then you feel that, yeah, you are better. But this pain will reoccur. Okay, so trauma, lower back issues, arthritis, one of the most costly affairs throughout the world. It's actually harming your psychological trauma. It is giving you socially, or you feel that you are boycotted, in sense that you don't want to go and meet people. While suppose if a person has to attend a meeting in the office and he's already suffering with a lower back issue or a sciatica pain, he doesn't want to attend those meetings because he is unable to stand for a longer duration. He has to take the cause is already given, the cause of lost working days, because he doesn't want to go to the office because of some kind of that. He has to stand for a longer duration, he has to take rest. So these are the major causes which actually psychologically also disturb you a lot. It restricts your daily living activities. Like people who have got lower back issues or knee issues, they stop going for walks, going to meet people, attend their social functions, because they know that it's harming their daily living, it's harming their activities. Earlier you used to walk or run for half a kilometer, or maybe 2-3 kilometers, 10-15 minutes. But right now, after this musculoskeletal pain, it has been restricted to only 5-10 minutes. So it's actually creating a lot of problems to you, as well as psychological disturbance to you. Next. Can I have the next slide, please?
Yes.
Okay. See, already I mentioned that a statistic shows out of 10, 2, 3 people in the world might be having some kind of joint pain. And Indians, out of 4, 1 person above the age of 18 is showing some kind of chronic joint pain. As you can see in the diagram already, shoulder, elbows, wrist, these pain are shown in the population, percentage of population. In India, most common is the knee one, which 17 to 20% of people are having, and that too above the age of, earlier the age was 60 years, now it is reduced to 45 to 50 years of age, because people are playing also. So people who are athletes, they are running, they are doing some kind of activity, definitely will have a fall or something. So the hurt is also, trauma of the knees is also increasing. So knees is one of the most frequent sites which is having chronic pain. The second is the lower back issues. Reason I've already told, the wrong postures is leading to lower back issues. Hip is the third one. When you have a lower back issue, definitely in slow course of time, your hip is going to be affected. And ladies, because of the reason of obesity, lethargy, and nowadays everybody is sitting for a longer duration, so hip is the third most frequent site. The last is the arthritis, chronic joint pains in the joint areas above the age of 60 to 65 years. So this chronic pain increases after that if you don't get a proper treatment. Next. Now, what definitely you are, if you are having some kind of joint pain, what people generally do is they go to the doctors, their GPs, or somebody goes to a neuro doctor also, and they are taking the medications like analgesics ho gaya, NSAIDs ho gaya, steroid injections. People are taking injections in their joint areas to give more flexibility to the area, pain reduction. And those who have got rheumatoid arthritis, RA is becoming very common nowadays. So those people take anti-rheumatic drugs. But these medications will give you, some kind of relief for the pain for some kind of time period. After that, again you will start having the pain. So what common effects also, it's along with the pain, it's the common effects which is causing you in your daily life when you are addicted to medications is you feel drowsy, you feel sleepy, irritation level increases in your you can see a person who has got some such kind of diseases in your family, irritation level increases because they are socially not getting that much of confidence to attend all social functions, meeting people. So irritation level is increasing. People have acidity problems because analgesics and all, they a long term of use causes acidity or stomach burns. Overdosage can sometimes lead to heart attacks, strokes also. People gain weight. They have noticed that yes, whenever they have started eating such medications, the gain in the weight is increased. You start getting addiction of the drug. Like in sense, as I earlier also told you, migraine patients, if they are taking the drugs, and if they feel that yes, today I'm having a little bit of some pain in the head region, headache, they take the drug thinking that once I go out, the pain will increase if I won't have drugs. So they are getting addicted to the drugs. And the most common is it is reducing your immunity levels. It's making you more prone to the infections because your immunity level is getting down. You are getting addicted to the drugs. The next slide. Now, because of all these common reasons, people have started taking up alternative therapies. There are many alternative therapies throughout the world for musculoskeletal, specifically for musculoskeletal diseases. The basic reason why people are approaching to these therapies is because they initiate the self-healing capacity of your body. When you work on your body, when they work on your body, they increase the body cells to rejuvenate. Uh, it increases the circulation level in your body, increases your immunity, and overall there is a harmony and wellness in you. So it is a kind of a total package of holistic treatment. So that is why alternative therapies nowadays are gaining too much of popularity. The other reasons is because some might use surgical method also, like Ayurveda and all, they use surgical methods also. But generally all others, they use herbal drugs, non-surgical methods, which does not harm your body. They are not giving you any kind of medications also. Medications, if they are giving, they are the herbal ones, so they are not going to harm your body. So a number of practices which are like prevalent nowadays. Ayurveda is very famous everywhere. People are adopting medications of Ayurveda. They along with the allopathic, they also prefer to go to Ayurveda doctors to take a second opinion. Homeopathy is very common. Naturopathy and Panchakarma has just recently started gaining popularity. Siddha is popular in the south regions, basically in Tamil Nadu. So we want Siddha. It's actually a holistic treatment part. It's a way of living. So that is why we want to take it to a much wilder scope of that. Acupressure is already very common, and another is sujok therapy, magnetic therapy. They are common outside India also, because people prefer alternative therapies in any kind of diseases. The next one. So, as you can see in the diagram, so these are the various modalities which is used in musculoskeletal pain and diseases. The Siddha actually basically comes in the Ayush one, as you can already see, alternative medical systems. Ayush, in that, S stands for Siddha. It incorporates the manipulative and body-based therapies also, in which we perform some kind of pressure therapies, which in another words, in Chinese therapy they call it massages. Chiropractitioners are there in US and all. They do the manipulation of the body, so they come under the manipulation and body based therapies. The energy therapies are there, like Reiki, Sujog, magnetic therapy. They all come under energy therapies, means they work on your energy levels. As there is a thought which will we cover a little later. Energy sessions are being done during through those things. Mind and body interventions. Nowadays, many people are aware about yoga, spirituality, relaxation. So all these things give you mind and body relations, keep you calm throughout your. It's actually accepted as a, to keep you more calm and cool throughout your day. You do yoga practices, and it keeps your too many other diseases also far off from you. Can I have next? Okay, so understanding Siddha. Now we will start with our basic topic: how Siddha deals with the with any kind of diseases, or particularly musculoskeletal diseases, and how holistically it treats you. So it is one of the most oldest Indian traditional practice. Manuscripts shows that it is more than 10,000 years old, and it is gaining popularity because of its holistic treatment. It comes from the word chitti. When people read the manuscripts from the in Tamil Nadu, it comes from the word chitti, which means that people who were there, like Siddha means Siddhakars, the people who used to do meditation, they attained the perfection, eternal bliss. So the Siddha has generated from them. Siddha means like people, Rishi Muni, you can call them in a more general way. Those people who attain that siddhi to treat people comes under Siddha. Now, it stresses more on your healing and overall wellness of your body rather than treatment, which is a difference in the part of your allopathic treatment. Okay, so you can see healthy isn't a goal; it's a way of living. So it's Siddha is a way of living. How you should take, see, pain and all these things will be a part of your life throughout your existence, but how to take it into a positive sense and to work on it is Siddha. So it provides preventive, promotive, curative, rehabilitative, and rejuvenative through its policies. Next one. Now, according to Siddha, what can be the causes of disease? It's actually, Ayurveda and Siddha go parallel. Parallel in sense, both are from long, long years back, and both have been accepted in the Ayurveda has been accepted as compared to Siddha more, but still they have the same concepts. If you read them clearly, they have got the same concepts which are running through the systems. Like in case of Siddha, the three life factors of should be in equilibrium: the Vatham, Pittam, and Kabam. Okay, so these are the life factors. You can call them doshas. Vatham is in your childhood, Pittam is in your adulthood, and Kapam is in your aged old. This is the Siddha process. The Ayurveda goes the reverse form. Like they consider Kapam in the childhood and Vatam in your adulthood. Pittam remains the same in the adulthood. So, but basically the thing is, these life factors or the doshas should be in equilibrium. Any change in these leads to some kind of disease. Maybe any other, maybe a heart disease or any kind of other disease, and particularly as we are talking about MSDs, we'll speak about that. Okay, so which factors lead to such kind of diseases is dietary. Any type of diet which you are following and not according to your body systems can lead to such change. Anyhow, nowadays people are not they are all eating outside. What junk we all are eating is actually causing a lot of disruptions in our body. Then your lifestyle, as we already mentioned, people are sitting in front of laptops for a longer duration. They don't want to go for walks or gyms or do any kind of yoga, so their lifestyle is getting disturbed. People are skipping their meals because of the meetings they have to attend in their offices. We all are aware about all those things. So lifestyle change, imbalances in that can cause disease. Emotional, any kind of trauma you have in your family, any kind of deaths, or any kind of wrong feeling, wrong notion that you're getting from your own nearabouts, yourself, can lead to some kind of disturbance in your body. Environment, as you already know, there are so many changes in the environment. There are, so these toxins actually cause some kind of change in your body ratio and leads to diseases. Genetically, it is transformed from your body, from your ancestrals to you genetically. Suppose rheumatoid arthritis, if your family, anybody from your family is having, it will be transferred to you, or maybe any of your siblings, or not to you, to your next generation. Diseases like hypertension or diabetes, if they are genetically going into your ancestors, might come to you also. So these, basically these factors are causing a little bit of disruption in your natural balance. Next one. Yeah, definitely emotions have a very deep effect. So let's cover them later on. What is the philosophy of healing as per Siddha? So Siddha actually practices, so basically Ayurveda and Siddha, as I already told you, go parallel to each other. So basically the words can change among them, but they are talking about the same things on a larger level. So in Siddha we practice ancient healing ways like Nadi Vadyam and Marma Chikitsa. Marma Chikitsa is there in Ayurveda also. So basically, what are nadis in Siddha is, they are energy channels which flow throughout your body, and in that electric current is passing, like pranic energy throughout the body, which when gets harmed or gets broken down at any place, can lead to some kind of disease. So if somebody has read among you traditional Chinese therapy, these nadis can correspond to the meridians. They tell them meridians which is running throughout your body. We in Siddha call them the nadis, those which are running throughout your body. So basically, they facilitate the energy levels in your body. doshas, like restoring the natural equilibrium of doshas, means doshas are the same: vadam, pittam, kabam. So when we talk about healing in Siddha, Siddha works on equilibrium of these doshas.
Ma'am,
They
can you
try
go a
to.
little slow? Can
Okay.
you go a little slow? You're going very fast.
Okay, fine. So these doshas, kabam, pittam, these doshas, Siddha tries to stop them and get your body into a harmony. Like how they do it, they helps in purifying the body as to what toxins are accumulated in the body with different kind of pressures which we apply. Externally, we give some kind of medicated oils or any kind of treatment, which we'll cover a little bit ahead. They try to clear all those toxins from the body. So this in this way we can harmonize whatever energy is flowing through your body, and any disruption we can clear those knots. They are basically called as knots. If somebody must have heard about myofascial trigger points. So those in allopathy we call them that, and in Siddha we call them knots. So you can feel those knots while touching. The healers or the persons who are doing the Siddha, they feel those knots, and with the pressures they clear those knots. So what the feeling is, these knots actually are causing the blood flow in the forward area to be stopped. So they are the disruptions. With the pressures and with any kind of other therapy, as we'll talk in the next slide, the Vermum therapy or the Thoknam therapy, which is very common in Siddha, we clear those knots for a good flow of energy. This has already been mentioned, the meridian system. As you can already see, Chang S, the meridian system, it has been highlighted in that. So anybody who wants to refer to it can go through that. Uh, in acupuncture also we use those, because in traditional Chinese therapy they use the meridian word, we use the nadis word. The next one. Okay, so some Siddhakars feel that it is the other way, which we have already talked about, the Nadi one. So others feel that yes, humans have got some kind of aura. Like the place where I'm working, Chakrasid, Dr. Sindhuja, she is an expert in Siddha. She can see through you, like if any disruption is there, while seeing you only, she can guess that there is, she can see the multi-dimensional in you. So the pattern of treatment which is followed in Chakrasid is, if she sees some disturbance in you, like your aura is disturbed, she gives you energy sessions. So energy sessions basically, what it is like, I will speak to you in after 2 3 slides also about this energy sessions. But basically, with pressures, she will touch some areas, and she will ask you, is this person related to you? She will take out somebody's names. She's got such kind of capability that when she touches some points, she takes out the names, and you have to verify. Okay, some person came into your during any kind of your years. I mean, many years you have been in contact with that person. So whether he is affecting you in a positive form or in a negative form, if you recognize that person, this knot will be cleared, and you can see that effect in gradual days. You will feel much more lighter. uh, your pain starts decreasing. So these, a biofield or aura, she sees that aura of yours. So let's come back. So some siddharths believe that human energy system has got some kind of auras. You can see the 7 layers of auric system which is coming out from the human body. So these auras, it is felt like that electromagnetic field is there. Three main nadis which are considered, they corresponds to the spinal column of us. Like the backbone of us is considered as the three main nadis, and they have specific functions like psychological also and psychic centers, which are known as the chakras. So what are these chakras? These are the places which take the information throughout your body. They work as conductors. They take this electric electromagnetic current throughout your body, transforms that information to different areas, and treats you. So wherever there is a hindrance, these nadis carry the current, and if there is a blockage, they get collected over there. So with the pressures, those are cleared, and then the information is carried to different areas of your body and heals you by that pattern. Anybody, I know everybody knows it. If there is a knot, the other areas start getting less of supply of oxygen, less of supply of blood, because blood only carries the nutrients as well as carry your waste products, the oxygen to the areas. So then we start having the pain. This is the basic theory behind what Siddha follows. The next one. Now, at Chakrasid, what we do is we don't follow a single pattern to treat you, but it is a holistic pattern, a holistic approach to wellness. So we take a multimodal approach of different, as we already mentioned earlier, there are different type of alternative modalities which are used throughout the world for different kind of diseases. For at Chakrasid, we follow different these multimodal modal approaches together to make you better, depending upon the severity, depending upon the duration, depending upon the area what where the disease is. We use such kind of approaches like manipulative and body based therapies, in which we manipulate the body by certain procedures which we follow in Siddha. Energy sessions, as I already mentioned you, Dr. Sindhuja does those energy sessions. Therapeutic touch means the touch and the clearance of those knots heal you, the healers heal you by that. And mind body techniques, utilizing the yoga exercises, by dietary modifications. These are all things which we together uh, hold together to treat you. The next one. So let's cover them individually. Okay. So first comes the manipulative and body based therapies, which is basically used for all musculoskeletal diseases. Because see, if you have a disease at one point, very clearly point, the pain will be at one place, but you can consider the disease might be at another point. I mean, the knots can be some other at other some place, and it leads to the pain to some other point. Okay. So Siddha in Sada, what we do is we manipulate the body, we manipulate your bones, uh, not only including at one area, but whole area. Like suppose if you have pain in your hands, okay, so according to Chakrasid, we don't do only the hands. The point can be there in any portion of your hand. It's like in any part of your arms, it might be there in the shoulder, it might be there in your neck. So we will do complete neck till hands. We will clear all the points, because any point can lead to pain in your wrist region or in your hand region. Like suppose if you have pain in your if you have sciatica pain, okay, so sciatica nerves travels from your lower back to the ankle region. So pain can be the point can be there throughout at any place in your sciatic nerve which it is pressing. Okay, so we clear from the lower back region to your ankle region. Everything will be manipulated. We will put pressures on all the areas to ease out the pain, so that those knots are clear and you start getting the ample supply of nutrients. Blood supply is manipulated, then ample supply of oxygen is there, uh, to make your pain lesser and to make to gain more flexibility in those joints. So you, as in layman's term, I have explained everything. The correction of misalignment, like people have I showed you the wrong posture. So we do the correction of this thing. We do the correction of your kyphosis or your hyperlordosis and make your spine a little straight. Okay, by the pressures in the back region. It works on your bones, joints, soft tissues. I think so. Everybody must have realized that if you have a lower back pain, you don't try to, bend forward, or you don't try to go backwards, because you feel that area has got stiffened up. So we releases that stiffening also with the pressures. In Siddha, we use that thokanam, as I told you, that is the spinal manipulation, correction of misalignment of any kind of your lower back, and pressure therapy. We call them the Varmam therapy. Varmam basically is some pressure treatment. Targets energy points in your body, like you can already see in the diagram, they are putting pressure at particular points. So these are the energy points, which where pranic energy or the life energy is stored, and it is getting harmed. So once you put the pressure, clear all the areas, there is a equal flow of this energy throughout your body, and it treats the pain in due course of time. It will take a little bit of time, like few days, it will take maybe a weeks, but gradually and slowly your pain will come down, and you will have a pain-free life. The next one. The next is the energy and the therapeutic therapy. Like you can tell it as an energy session. Therapeutic touches all the healers. They feel that any aura is there around you, any positive aura or a negative aura, and they work on it. Now, how they work on it is the energy session. Like Dr. Sindhuja, she feels whenever she sees a person, she feels yes, it's a positive aura or a negative aura. So she determines that if it is a negative aura, patient might need energy sessions, which will work on making them more that positivity from inside. Okay, so the positivity will be cleared from inside also, as well as from outside. So it influences your energy system. Any disturbance in the energy system can lead to some kind of physical problems. When this As I already mentioned earlier also, that energy whenever disrupted can lead to some kind of disease in your body. It might be psychological also, it might be because of any trauma to your family, you feel disrupted, or any known person, if he wants to harm you in any way, and thinks bad about you, it is accumulated in you in the form of knots. So she works on those knots to clear those knots and give you a pain free life. Your disturbed state of mind can be cleared by that, and give you a harmony in your life. So as the last sentence already tells you, that it is not visible. Okay, it is not visible from the outside, but the patient, if you see the patient, the people around you might feel that yeah, you feel much more positive, you're more smiling, there is a feeling of goodness in you, those are the output in the more tangible and visible form. Like your pain reduces, you are more rejuvenated, your skin sparkles when such energy sessions have been done for you. So it's a way of living. It's actually miracle if somebody is getting treatment done by Dr. Sindhuja. It's a miracle. If energy sessions she does, it's a miracle. We only can, we as doctors uh, can speak to the patient, take their symptoms, but she is the main person who does these sessions, and it's basically unimaginable. And to tell you all that I also, being a patient of ma'am, joined Chakrasid on this basis only, that I got treated so well that this made me to join Chakrasit, to know what all this. It was actually a new for me, being a dental surgeon. These things doesn't come into your daily affair. You go for just medications, but this was a miracle, just happened to me also. So anybody of your known persons, if having some kind of musculoskeletal diseases, tell them to give a chance to their bodies, just one chance, and they can be out of all these problems, issues, coming to Chakrasid. I'm not trying to give you a kind of thing that join come and but one should take a chance to their body. You can tell them that please give you a chance to your body to heal on themselves. okay, before going for any kind of surgeries or anything which can lead to a problem later on. Give your body a chance. Next one. Okay, so mind and body techniques, as all nowadays people are getting aware as to what dietary instructions should be there, yoga, meditation. These things are incorporated into your body nowadays. Now, at Chakrasit, we detoxify you. The reason being, it clarifies your mind, your body, toxins are removed, it de stresses you. Any kind of diseases are there, maybe can be cleared by detoxification also, like liver diseases are there. Some kind of liver disease might cause other pain related, like in autoimmune you have in like rheumatoid arthritis. Okay, so diet plays a very important role in that. So detoxification can clear many of your impurities from the body and can make you physically more stronger. Yoga, meditation, they help you to strengthen the body. It gives you peace of mind, and improves overall health of your body. Yes, weight also. You can clear your obesity through detoxification. It clears all your whatever toxins in your body, and it reduces your weight. In fact, we had a patient from US in Chakrasid who had come to India for a bariatric surgery. Okay, she had weight around 120 kgs. So once she was about to go for bariatric surgery as well as her lower back issue, because she a lot of weight causes lower back issues. So when she came to us, she thought ki let's give a chance, without going for surgery, if she can reduce her weight. So by a process of detoxification and the Varmam therapy which we provided, ma'am did energy sessions, she lost at least 20 to 22 kgs. That was unimaginable for us also, and for her own family it was a miracle to them. Okay, so she just didn't go for any kind of surgery. She had a lymphedema in her hand. So next, in her next visit after 6 7 months, she came for her lymphedema in hand also, because she had her lymph nodes removed. There are n number of patient stories I can tell you. I will consider them in the next slide. Try to practice detoxification, yoga, meditation through your life. It will cure you from internal bliss. Okay, the next slide. These are the dietary modification in Siddha. See, we give according to your disease condition, according to your blood groups also, some dietary will be told to you. So basically what is food actually influences the doshas, as we already talked. Life factors are there, so it actually affects your doshas. It might increase at any time. So these are, while treating at Chakrasit, we want all the patients to be sattvic, means vegetarian. Okay, so consideration is that non-vegetarian increases your inflammation levels. So when you're getting treated for musculoskeletal diseases, at least you don't want a thing which increase your inflammation level at your joint areas. Okay, so these are the category of food which Siddha is considering: sattvic food, rajasic food, and tamas food. So these are the personality traits. Like if you have sattvic food, you will have positive feeling, you will have a lighter feeling, your nature will be much caring, happiness will be there. Rajasic food is, you feel active because you are having such kind of things which will make you more active. It will give more affection to the people. Tamas food is actually a negative aura it will give you. It will increase more of your anger, means the feelings which anxiety, emotional, you feel dull. So this is according to Siddha. It's not that everybody gets this, but it's just that earlier Siddhikars feel that these are the kind of food which can give you such personality traits. Okay, so importance is sattvic food always will keep you light. Like the food, if you incorporate into your daily life, will keep you more lighter, more juvenile. It give you more peace and calm in your body. Like examples I have already given you: rice, wheat, millets, cucumber, sesame. These are some kind of examples. If you want a full detail about it, I have already mentioned the where it has been taken from, fundamental qualities of food and their impacts in three gunas in Siddha. So it has already been mentioned in that study. You can see as to what food, any other items can affect you. You can also include cow milk in this. Paneer can be included in this. Rajasic food, it gives you more of activity, keeps your mind accumulated, every time active in that. So you can consider tur dal, chana dal, chilies, tamarind in the Rajasic food. Now, tamas food increases heaviness in the body, gives you more dullness. What examples are there, like onion, radish, especially buffalo milk if you're having potato? We include these things in your diet, in your daily diet also. Reduce the quantity. That's what the Siddha tells you. It can, because it can affect your personality traits. Okay, so if any detail you want, you can go and visit this fundamental by Siddha. It's a review by another Siddhakar. So you can take a detail from there. Next one. Like, as I already mentioned about a patient from US, this is another patient at Chakrasit. Now I'll take 2 3 cases as to how Siddha at Chakrasit is followed, and how we treat the patient, what outcomes we have got. So can you see the patient, how he's walking? I have drawn a line on the shoulder region. This patient is 32 years and is having lumbar scoliosis. Okay, lumbar spondylosis is very common, in which lower back pain is there. Okay, but slowly and gradually the patient developed scoliosis also while sitting for a longer duration, because his office hours were like 10 12 hours. So he sat for a longer duration, and gradually there is a disruption in your shoulder level, in his shoulder level. So while walking also, he was limping forward, and he has to wear a belt. Can you see the belt also? In the third smaller photograph, you can see he's wearing a belt to keep his body straight, because he was unable to walk straight. This has also created problem in his knees, and his walk was disrupted. He felt that, yeah, his body was tilted towards one side. So after, in the x-ray, as you can see, his hip region, I have drawn a line as to show that his hip was so higher, and his left hip was so down. There was a disbalance in his body. After treatment, 22 days properly treatment ke baad, can you see the difference in his shoulder level? It came to a level, and it is also visualized in his x-ray. Post x-ray, can you see the level of hips has coming to a one position? Slowly and gradually, if you do exercises, keep your body straight, the alignment of your spine can also come straight. Okay, so I have shown you the both the difference. Yeah, definitely, Samiksha. I'll cover that. You can ask the questions later on. I will definitely cover that also. Okay. So the he was unable to stand, walk properly. Standing, walking, taking steps was a very difficult aspect for him. But after the treatment, post treatment, he was perfectly fine. He could walk for half an hour to 45 minutes with a faster pace, which was actually, a miracle to his family members. They were literally like, and his level of happiness was unbelievable. Okay, the next one. So this is osteoarthritis, as we commonly see in patients, after the age of 50, 55, 60. This arthritis is increasing day by day in all the patients. So one patient who was age 69 years, see, I have taken two patients which of the age, in sense, like, we put the pressures on the patient. So aged patients were also able to take the pressures and could show the difference in their x-rays. Can you see the first x-ray, in which completely there was no space? Okay, the inner portion, can you see, there is no space. I have put a red circle around that area. There was no space between the femur and the lower bones. Okay, tibia and fibula, there was no space. But in the second one, can you see there is started space in between? There is a gap little between both the knees, both the in the knee joint. Can you see it? So this is after 20 days of treatment. So the patient was called again after, yes, this one. So this is the improved area. Okay, so this treatment was done for around 20 to 25 days in first phase, and then the patient was called in the second phase also. So, but we didn't go for the X-rays after that, because taking X-rays again and again is harmful. So this was the only pattern we can tell everybody that yes, it has started improving. And of course the patient can see with their walks, number of times they can climb the stairs, the long they can stand, the longer they can walk. This is the way it can be seen by the patient also. Okay, so the next one. This is the second case. Okay, again with the, no, the previous one. The previous one, yeah, this is the second case. Okay, so again, patient is aged 81 years. The earlier patient was around 60 to 65 age. This is the 81 years aged. Okay, a patient was having severe osteoarthritis of the grade 4. Can you see the difference? I will not cover up completely as to what it is written. You can read it. He was not able to walk also. The knee was such jammed that walking was not possible for the patient. Taking stairs was impossible, and he was not able to keep his legs into folding, like with what we do during yoga and all those things. So after post treatment x-ray, can you see, I've put can you see the gap in between? So this much improvement we could give through our Siddha treatment. Okay, so anybody of your known people who is suffering from osteoarthritis, tell them, before going for surgery, before going for any kind of knee surgeries, should give at least a chance to improve on its own through these kind of treatments. Next one. Next. Yeah, avian. So this is very common nowadays among young adults, especially the males after COVID area. COVID time ke baad, this avian avascular necrosis has increased. Basically, what it is infection in the pelvic region. Like you can see edema in that region. Infection means water accumulation there. People are unable to, take their legs apart, like while doing exercises, how we take our legs apart, that was not possible. So basically, males while driving their two wheelers were not able to take their legs on the other side through this thing. So we had a patient of 26 years old. Just imagine, a 26 years old. He had a severe COVID. So after that, he came to us with this problem, avian hip joint area. And after 22 days of treatment, he was able to walk for half an hour, was able to do all his activities, do his exercises, which we told slowly and gradually increase it. But as you can already see in the first one, the pre-treatment, it was totally jammed. Okay, see the coloration of the x-ray, and in the other one you can see that it's a little bit gap in so this gradually increases with exercise also, with the treatment part also, because the infection slowly reduces and the bone slowly and steadily becomes little stiffer. Okay, so in this way we treated this patient. Next one. So these are the evidences. As I'm working in Chakrasid, Siddha therapy, have gained a lot of popularity outside India also. Okay, so these are some evidences I can show you, out of which first, third, sixth, and eighth, you can see these are case studies and the studies which we have done in our Chakrasid, which has been published in international journals also. So they have acclaimed, taken up as a good study material, and they have been published in these journals also. So basically, what I want to tell everybody here is, give a chance for you, your known ones. If you find any people suffering from any kind of musculoskeletal diseases, I will tell you, like plantar fasciitis is there, neck issues, lower back issues, scoliosis, AVN, avascular necrosis. All these treatments are possible through holistic Siddha therapy. Do take a chance and uh, try to heal your body on its own. Thank you. And I can take up the questions now. Anybody who has their questions can ask right now. Good morning.
Thank
Good
you so
afternoon.
much. Thank you so much, ma'am, for this incredible session. Now we'll have a short poll to the audience. You can answer the poll which is on your screen. And our founder, Ms. Srivani Mullapudi, will initiate the Q&A.
Okay, fine. Good afternoon, ma'am.
Thank you so
Namaste.
much, ma'am. Such a wonderful session. In fact, I actually myself, I have not been exposed to Siddha at all.
Yes,
And
ma'am.
I had a cousin called Narayan in Coimbatore, and he was telling me his grandfather, Mr. G.D. Naidu, who's an extremely respected businessman of the South. He used to be a Siddha himself, and he used to follow it. It was then that I got curious about Siddha, and I wanted it to be shared on the Vishwa platform.
Thank you, ma'am.
Thank you so much. Thank you to your institution for keeping this science alive, and for the research that you all have done to ensure at a time, where in our country we are losing our heritage, calling everything as quackery and superstition. You all doing research and showing that, yes, this works, this science works, and protecting it. Big thanks to all of you.
It's a pleasure, ma'am. It's a pleasure that you gave us this kind of opportunity to speak. And, being a patient myself, I felt that, I have to do something for people to, cure by this. That's why I joined Chakrasid. Dr. Sindhuja is a wonderful person. And I mentioned her that because of her unavailability, I had to take, otherwise she would have taken the session. And she is a wonderful person. And we would like, agar if any, in future, if you have any kind of session, you want another session, she will be taking over.
Yeah. So, yes. So I also would like to thank all the thank the participants, and thank Vishwa team. I thank the participants because, social media many times blocks Vishwa from promoting an event. So whoever has come mostly comes through word of mouth. So thank you so much for that. And thanks you to the Vishwa team for giving such wonderful topics, protecting our heritage and doing service of this kind. Thank you to Vishwa team too. Yeah. Now I will go on to the question and answer session. There's Mr. Nandlal. Please, can you ask your question?
Hello.
Yeah. Come on video, please.
Okay. Good morning, everyone. Good morning, ma'am. My name is Nandlal Kothari. I am calling from Rishikesh.
Okay.
I would like to know, as this session was dedicated to musculoskeletal pain management, I have a chronic illness in which my L5S1 disc has been, it has been reduced by 12, 15 mm to 3 mm. The size or the thickness of the disc has been reduced, which is giving me a chronic continuous pain, on especially burning sensation right from my buttocks radiating towards my leg.
Okay.
I have been taking a treatment for now almost 1.5 years. I have also gone through the surgery, as they said that there was a herniated disc and they need to remove that part which is pinching the nerve. So right now, in my lower back, I always feel a kind of stiffness. It is a kind of
Yes.
pain with the stiffness and burning sensation radiating through my buttocks, and my legs are very heavy. So whenever I'm walking, it feels like I'm walking with double of my weight.
Okay.
So is there any treatment in Siddha I can seek for?
Yes, sir. Definitely, there is a treatment at Chakrasid we can provide you. See, we get lot of many patients who have already gone through surgery, especially L4, L5, L5, S1, because that's the area which actually generates pain in the lower back issue as well as to complete leg. Okay, so we provide treatment, but for that, you'll have to stay at least minimum 15 to 18 days in Hyderabad because center is in Hyderabad. We do provide treatment for that. Okay, so the same pressure therapy will be given to you. Your diet will be modified. We'll tell you some exercise. We have physiotherapist who will particularly tell you all the exercises along with the treatment part of it. Okay, the thing is, in the surgical part, we will not touch that area, but around that area where you feel stiffness, because that stiffness is felt throughout your leg. You feel the bulginess in your leg, heaviness in your thighs, as well as in your calf muscle region. Okay, so we will treat. The treatment is possible, sir. But only
But
thing is,
But
yes.
the question was that the disc, which has been considerably or significantly reduced to 3 mm, which is according to the physiotherapist, or I have been with the chiropractor and also the doctor. They said that because of because the cushioned area is significantly reduced, and that is the reason it is causing pain and it is pinching the nerve. So how this could be benefited from Siddha medicine?
So that's what we have a manipulative system, as I already mentioned. With the pressures, we will create that area, that cushioning ka jo area hota hai, we will provide that space between both the L5 and S1. Okay, we see already the area has been operated, so less pressure will be provided in that area, but the other areas which are also causing you pain in throughout your leg area will be recovered. You don't have to worry, sir. All the movements, all the walking and all will be provided by Siddha. You don't have to in fact, you can see the changes because we tell you to see after 3-4 days only that what changes do you feel. Is there any flexibility increase? Is there any pain decrease in there? We continuously monitor you for throughout days you will see spending over there. And without any medications, we won't give you any medications, but with the treatment, with the pressure therapy that will be provided throughout your leg, will give you more ease in flexibility as well as in pain.
Okay. So you said that minimum 2 weeks up to 3 weeks.
Yes, sir. That you have to stay because the center is in Hyderabad only. Dr. Sindhuja is there, and the team works on you. There is Dr. Shankar is also there. Both of them treats the people. They see you once or twice throughout the whole sessions. I mean, throughout 15, 20 days, whatever you stay, 3 weeks ka time period. And you can see the difference in your pre-X-rays and post-X-rays, as we already seen in the slides. That way we will show you. And moreover, you can see in your quality of life. Like earlier, like if you are walking, not able to walk properly for even 10 minutes, after the session, how much time period you're walking. That means there is some difference in your body, okay, which was causing you harm earlier. But now that if you are able to walk a little bit, running, bending, so all those symptoms, if they are reduced, that means it's a betterment in your body.
Got your point. And where can I get more information regarding the the accommodation and the cost and other thing?
Sir, you can call upon, you can see the website of Chakrasit. There is this toll-free number is there, or if you want, you can call on that number, sir, because they give you the appointments also. They will tell you whatever is the process forward. They will guide you, sir.
It is Chakrasid.
CHAKRASIDDH.
Okay. 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 Thank you.
Thank you. Thank you so much, sir.
I will conclude this session. We'll continue the question and answer after that. Would like to share with you the upcoming sessions. There is one on ecology and environment coming from an organization, Green Living, waste management techniques. The speaker is Ms. Kamna, organization TSPA. Date 13th July 2024, 11 a.m. Are you sharing the screen? Yeah.
Okay.
Next,
Thank you, ma'am.
the next talk will be from Pema Wellness Center. I'm really sorry to say, would like to share that Dr. Murthy, a naturopathist, very well known across India, he's no more. He's passed away yesterday. Really sad about it. As alternative therapies, India promoted naturotherapy, and he's no more. And okay, from Pema Wellness Center, we're getting a speaker, Dr. Muthu Murugan, on 27th July 2024. The topic is Healing with Needles, Introduction to Acupuncture. We have another event coming up on 20th July. This is an offline event. Our pride in making Hyderabad a zero-waste city. The session is from 9 a.m. to 1 p.m. Venue is Hyderabad Radisson Blue. Vishwa has completed 150 talks. So we will be having a physical event. The idea is that different stakeholders from the city will get together, discuss what are the problems, how do we make Hyderabad a zero-waste place. It will be a closed-door conversation where everybody can freely discuss with each other. Very prominent think tank will be together discussing. It will be wonderful if any of you or people you know who are passionate about the environment, please apply for it. It is only an invite-only event, and there's limited number of seats. There are only 100 seats, already 500 have already applied for it. If you feel anybody is really good and can contribute to this topic, please share it with them. Thank you so much to everybody.
Thank you, ma'am.
Yeah.
Thank you.
With this, I will open the session for Shmuel. Please ask your question.
Thank you very much. You hear me?
Yes.
Yes, sir.
Okay. Very interesting presentation. And I want to ask you if you recommending to another countries, another governments to use methods of Siddha Medicine, if you recommending to healthcare systems of another countries to implement the approaches of Siddha Medicine.
Ma'am, did you follow?
Yeah. Different approaches. He wants to know the.
Sir,
Can you repeat the?
Are you saying that would you recommend Siddha to other governments to implement it? Is that your question, Mr. Shmuel?
Yeah.
Okay.
Yeah. If you recommend it to another governments, another countries implementing the methods of Siddha Medicine.
Definitely, sir. We would like, thanks for such a lovely question, because see, Siddha is a way of living, and we want everyone throughout the world to go through this Siddha treatment, to give a chance to your body, as I already mentioned. And we want all the governments, we ourselves want, to approach. In fact, Dr. Sindhuja is taking few of their patients from US also. She had gone to US and done the treatment over there also. People from US, UK, they definitely travel to India, to Hyderabad, to take the treatments. As we have already seen one patient I told you about US, she had lymphedema. We want to actually approach other governments also, but that can only happen through governments. We as institutes can approach the patients. They can see all our websites and can approach us. But yes, we definitely want governments to really take this into serious issues. And it's actually good for all the people to take such kind of treatments, without harming your body, without taking medications. Such good treatments are available, that it's a miracle to everyone. So in fact, if anybody over here is from government, we would like, to approach such kind of treatments and, take it to a much higher level, ma'am.
Ma'am, doctor, are they, like, you have medical colleges? Are they Siddha colleges in the country?
Yes, we have, ma'am. We have in Tamil Nadu, several Siddha colleges are there, which who are providing Siddha medications. So there are two concepts, one, people who are coming out from the Siddha medical colleges as Siddha practitioners. One is the practitioners who have taken it from generations, like Dr. Sindhuja is from generations. She is the 36th generation who is continuing this Siddha medication. So it's a tradition from her own family. Okay, so we have doctors who are from Siddha background working in our institute at Chakrasit, but she herself is a traditional based Siddha practitioner. So what they say is people who are born into some kind of stars can only take that much of magical, magic into their hands. So she is among those people.
Are there other such institutes across the country?
Yeah, ma'am. There are many, especially in Tamil Nadu, people go for Siddha a lot. So we have many colleges, many institutes, many private hospitals also for Siddha over there.
Shmel, is your question answered?
Yeah, this answer, and I have a little another question. I want to ask you if Siddha medicine can support effective treatment in cognitive diseases like dementia and another cognitive cognitive diseases.
See, sir, diseases like dementia or any kind of like age-related diseases, we do cover. Dr. Sindhuja does that, but basically, right now we are covering more of musculoskeletal diseases, and to a higher level, we also take autoimmune diseases like Crohn's diseases. We have taken up. We have taken up rheumatoid arthritis, also fibromyalgia. We are treating, but dementia and all those things, because she's the only one person who can treat it. So on a larger scale, we are not taking those things, because otherwise she has to only see the patients. The other things can be looked after by another doctors also, another therapists also, healers also. But specific like the conditions like these can be treated by only her. That too, we'll if there are any patients, you can contact us. We will definitely get back to you regarding that.
Okay, thank you. Okay, next question.
Thank you very much.
Thank you. From Samiksha Prasanna Patak, I met with an accident. As a result, ligament tear is there. What do I do? Please advise.
Okay, so ligament tear, ACL tear, we treat, because as throughout the session, I already mentioned about athletes who get hurt, and there are some tears in the knee areas, which we treat holistically also, as well as by applying some pressures, by monitoring them continuously, and tell the patients that after few days start doing all the process what you are not able to do it. Like suppose athlete, if he has already got ACL tear, there might be some stiffness in the joint, he might not be able to run or maybe walk with the same pace as earlier. So we do treat. You please get back to us on Chakrasit. There is a number mentioned. You can speak to our customer care. They will definitely get back to you regarding your treatment. It is possible.
Another question from Mr. M.A. Rahman. What are the natural remedies to regenerate cartilage in knee joints? What are the safe medicines anyone can take to maintain joints to arrest degeneration? Any medicines for patellotemoral?
Patella bone. Okay.
Yeah,
So,
knee joints.
Okay, so question is very good. See, regarding the cushioning in between the joints, precisely ligaments, if they are if totally gone, if like age wise there is a degeneration in between the bones, ligament, so if that is completely gone, it will not rejuvenate by any measures. Okay, if the patient has already been gone to doctors and they put some kind of steroids and all those things, but if once cushioning is gone, it will not regenerate by any methods. But the thing is, you can make your quality of life much better by making that area, because degeneration occurs basically if you are not getting enough supply of oxygen through the through your blood vessels. So if the area around the knee area gets cleared by pressure therapy, by any kind of therapy, like Ayurveda also put pressures, naturopathy also does some kind of treatment, Siddha also, like we put pressures, we clear the area around both the knee areas, I mean the joint areas above also, and in the calf region also. So we provide some kind of gap in between, like I already showed you in one of the slides, that by pressures we provide some gap, so that cushioning can never come, but there will be a gap so that you can move the area much better as compared to the other time when it was very stiffened up. So flexibility is provided by Siddha. That much we can provide by the Siddha treatment. So it will give you more ease about your walking, about your daily exercises, that you can do very well.
Yeah. Our next question is from Mr. Vasant Kumar. He will ask it himself.
Hello.
Hello, sir.
You can hear me?
Yes, sir.
Namaskara, ellargunu. I spoke in Kannada. Anyway, first thing is I have also undergone back pain.
Okay.
Mr. Nandanals, my request to him is I have also undergone that surgery, removing the disc, etc., etc. It has not really helped. What I have learned on my own, you can call it Siddha. As and when I feel uneasiness at the back of my pain, immediately I lie down on the floor, conduct some exercises. That gives me immediate relief. And one thing is I have reduced my weight. That also has helped. The second thing is about government intervention in Siddha. Siddha is a wonderful thing, and I have also practiced to some extent Siddha on my own, understanding certain things like some of our friends have undergone. So I request you to get in touch with the central government health scheme. There are wellness centers for central government employees throughout the country. They recognize institutions which are giving some sort of wellness. They are called wellness centers under the Ministry of Health and Family Welfare. You can approach them and get your institute registered so that the patients can, particularly those who are really suffering from joint pains. Most of them are retired people also.
Yes.
And you can just register yourself. It will be helpful for others and also to the institute. And my questions, nowadays children are becoming victims of mobiles, and they will be sitting in different postures, and that will be giving them very bad growth. process of growth will be actually troubled. Do you have, we will have to tell the parents about the Siddha system where we can make the children understand the problems of sitting at different postures and
Yes, sir.
rather making it difficult for them to have a good growth. Is there anything about it? That is one thing. Second thing is there any Siddha way of kicking the habit of tobacco, smoking?
Okay. Okay. So smoking and tobacco, sir, we don't go for it. Anyhow, I will, if there, you can get back to us on our website. But smoking and all these things, we don't deal with that. Okay, we only see musculoskeletal diseases and related any which ma'am does. She does many other treatment other than musculoskeletal diseases. And one very good point, central government, we are trying, sir. We are trying to get involved into their schemes and getting our aged people, who are suffering the maximum because of this disease, so that they get a treatment in that scheme procedure. We are trying for that. We are also trying for NABH. They had asked first to apply for NABH and then to go for that central bank scheme. So we are doing it, sir. We are on an approach to that. The second question, as related to your school approach, we already
Parents.
approached. Parents. We already approached because that's the only way we can approach the parents through the school. Anyhow, we are getting many patients for muscular dystrophy, for scoliosis, like girls at the age of like 11, 12, they are having scoliosis. So those people are coming to us for treatment purposes, and we tell them we have put many banners over there for the wrong postures which are leading to these kind of ailments, and later on also for children also. But directly approaching the parents is through schools only. We try to approach 1-2 schools. We are getting patients from there also, and whomsoever approaches us, the parents come, we tell them that the wrong postures has created this problem. So try not to do those, and to tell others also that wrong postures can create these problems. So we are already doing that work through our level, and higher work can be done. We are doing it. So we are trying our level best in
So
that terms.
You will be doing a service for the kids.
Yes, sir. We actually want to do it. We actually want to do it. That's why I had put those 2 slides, basically because aged people, if we all come to know that wrong postures are creating these problems, we will definitely tell our people, tell our children also, our known people who are around us, that yes, wrong walking, you are doing a wrong walk, you are wrong sitting postures. So we are doing our best, sir. We are trying our level best. Thanks for a lovely question. That was actually meant. We want that people who are doing this wrong thing should be corrected there and then, so that it has been taken over by children also.
As a social activist, I'm interested in some of this. With Shivanaji, can you think about having a session about how to give up smoking?
Sure, we'll definitely work on it.
It is possible because smoking is only a habit.
No, addiction, we will work on this. For sure.
Addiction.
Yeah.
In addition to that, I want to just put one sentence. It is a habit, habit. You can kick the habit. How? Remove H, a bit remains. Remove A, bit remains. Remove B,
Yes.
it remains. Next is I. I is myself. If I remove, what remains is T, tobacco. It will have the last laugh. Instead of that, kick tobacco, you remain. This is one of the
Lovely. Lovely, sir.
This is a quotable quote.
Yes.
I keep telling that in my lecture sessions to particularly 8th, 9th, 10th children who are in the age of 13, 15, because they are the future smokers. Tobacco industry is capturing them with e-cigarettes, vaping, julling, and all sorts of gutka, jarda, cigarettes, pan masala. So they want to ensure that many more people die and they get much more money. They are building their empire on the dead bodies, skeletons of their rather of the tobacco products. It's unfair. They are only living
Yes.
and letting it die. It's not fair. So the government must intervene and see that tobacco cultivation is reduced to the minimum. Then only, if there is no supply, there won't be a product.
Yes, sir.
Through this, I'm sorry, I have departed from the main theme. Thank you so much.
Thank you for being
Thank you,
so
sir.
passionate about something and sharing it with us. We'll certainly.
I'm 80 years old. I still want to be there. So for some more time. Thank you.
Yes, sir.
And say a good
Definitely, sir.
Sorry, you were saying something. Please
Yeah.
unmute yourself and say. You were saying something.
No, I was saying that this Siddha program is wonderful. Let it reach many more millions and let there be a good response and let people stop going to the doctors and start eating steroid tablets to get temporary relief and get finally buried. Thank you.
Thank you,
Vishwa is working at protecting our heritage. I hope we will make a difference. I hope Siddha will come back into mainstream. Yeah. So the next question is from Mr. KV Narsing Rao to you. Can you give Siddha basic training also like a crash course?
Ma'am, because this is a complete medical system, it includes 5 years of knowledge. Yeah, people take therapy. We have therapists who take a little bit of knowledge of reading all those books and incorporating into patients by seeing also, by doing it virtually, by doing it also. That way, therapists can gain knowledge. But yeah, doctors have to go through typical 5 year knowledge of the Siddha medical system. Anyhow, whenever a patient comes, we tell them certain points. We tell them, like people have started taking sujog and all those things, in which palm is considered as to be a complete body, so they know the points. So whenever a patient comes to us, we tell them certain point is a cause for your pain. We are clearing it. If in case later on it appears, try to put pressure on that and keep your body. See, basic thing is exercises and keeping your postures is the basic rule for musculoskeletal diseases. Maintain that, do exercises, do good eating, and you will be out of pain, as well as these a cure for musculoskeletal disease. If you don't do it, it will come back again.
Okay. Next question from Miss Neeta. Is there any such center in Delhi NCR?
Yeah, ma'am. I'm basically I'm in Delhi right now only, but we are trying to open up. But since Siddha is more prominent in South, and moreover, Dr. Sindhuja is the patron of Siddha. She is in Hyderabad, and for her, frequent traveling is required. So that is why we constricted it to Hyderabad only. But yes, if more patients are there, I am in Delhi only right now. So we will, if more patients contact us from Delhi or from North India, we will definitely have a center in North also, in Delhi especially.
From Mr. Vaidyanath Subramaniam, there is a question. I'm a homeopath. Is there a possibility of learning Siddha medicine through Chakrasiddh or any other organizations?
Yes, sir. We have, as a dentist, I also learned Siddha.